Eosinophils are named from the roots eosin, which is a red acidic dye, and philic, meaning loving. Eosin-loving cells are of the myeloid lineage granulocytic leukocytes. As you can see in this smear, the cytoplasm is replete with pinkish-purplish granules. It is important to note that these granules do not obscure the nucleus, which is one way to distinguish them from the basophilic granules that you'll see next. So what are the important functions of eosinophils? Well, first is to defend against the helminthic or protozoan infections by deploying major basic protein. Major basic protein is the major protein of eosinophils and is specific to the eosinophil. If you get a question on your exam dealing with eosinophils, it is likely that major basic protein will be in either the stem of the question or one of the answer choices. Eosinophils also help modulate allergy and the asthma response. They perform the latter function by releasing histaminase and aryl sulfatase that limits the allergic reaction after mast cells degranulate. Eosinophils normally make up 1 to 6% of leukocytes and have several disease states that cause eosinophilia. It may be helpful to remember the mnemonic NAACP for these diseases. This stands for neoplastic, asthma, allergic process, chronic adrenal insufficiency, and parasites that are invasive. Next up we have the basophil, again a myeloid lineage granulocytic leukocyte that is involved in allergic reactions, and that only accounts for less than 1% of total leukocytes. These are intensely basophilic cells that stain purple with basic dyes due to the dense basophilic granules. Note that these granules, unlike eosinophils, do obscure the nucleus and make its shape hard to make out. During certain inflammatory reactions, these cells release granules containing heparin, which prevents clotting, histamine, and vasoactive amines, which cause vasodilation and increase blood flow to the tissues. Leukotrienes, which mediate the inflammatory response, are synthesized and released on demand. In this flash quiz, let's identify each of these cells. This smear includes a monocyte, a neutrophil, and a lymphocyte. The monocyte is the largest and has a unilobular, kidney-shaped nucleus with frosted glass cytoplasm. This is our neutrophil, and in this image, it has a 4-lobed nucleus, making it a normal PMN. Finally, the lymphocyte is the smallest and has the highest nuclear to cytoplasmic ratio. We'll get to this one in just a bit. Next up is the mast cell, and mast cells mediate allergic reactions. In this image of a bone marrow aspirate, we can see 2 mast cells. When an allergen is in the body, IgE will bind to this allergen at the antigen binding sites here and here. And our mast cells can bind to the Fc portion of the IgE by the Fc receptor on the cell membrane. The IgE is attached to the antigen, or more specifically the allergen in this case, and when enough antigen is present to make the IgE cluster and cross-link the receptors, the cells will degranulate, releasing histamine, heparin, and eosinophil chemotactic factors. You may recall that there were 4 different types of hypersensitivity reactions from your immunology chapter. Which type of hypersensitivity can we link with the mast cell? Well, the allergic reaction is a type 1 hypersensitivity reaction. Examples of these would include asthma, hay fever, and allergic rhinitis. And what medication can block mast cell degranulation before it happens? This medication is used for asthma and allergic rhinitis prophylaxis, and that would be cromolyn sodium. The dendritic cell is not explicitly represented in my hematopoiesis picture, but do you remember from what cell we said this derives? It derives from the monocyte. Dendritic cells have a characteristic star shape with several arms, or dendrites, as this means branching structure. You will see this term in other cell types with neurology. These branches simply allow structures to have more surface area for sampling or exploring their surroundings. These cells are professional antigen presenting cells, or APCs. What are the other two types of APCs? Those are the macrophages and the B cells, but neither of these can beat the antigen presenting function of the dendritic cells. They express MHC class II and FC receptors on their surfaces, and when activated they pack up and hit the road to do the lymph node circuit so that they can present their new antigen to all the immune cells they can find. Dendritic cells are the main inducers of primary humoral immunity, aka the antibody response. Dendritic cells are called Langerhans cells when located in the skin. Remember this when you hear about Langerhans cell histocytosis, which is commonly known as histocytosis X. Later on, we'll talk about how to recognize Langerhans histocytosis X cells, but importantly on the electron micrograph, you will see the characteristic Burbeck granules that are shaped like tennis rackets. Now let's move from the myeloid lineage of cells to the lymphoid lineage of cells. Importantly, there was a long discussion in the immunology chapter that had an in-depth review of the innate versus adaptive immunity, MHC classes, lymphoid differentiation, cell surface proteins, steps in activation of lymphocytes, cytokines, and many other important topics. As you've already had a wonderful lecture on these topics, I will not repeat this material to you, but I suggest you take this opportunity to review this material, as it is vital to the exam. We'll start with our common lymphoid progenitor cell, and this will advance in one of two ways. It can either generate cells for the innate immune system, or the adaptive immune system. The natural killer cell, here on the left, and also known as the NK cell, is the only innate immune system cell to come from the lymphoid lineage. They act very much like T cells, that we'll discuss momentarily, but without all the need for the APCs and the MHC activation we discussed in immunology. So it is a special function of these cells to recognize infected cells that specifically do not display the MHC markers or have attached antibodies. These NK cells then cause apoptosis of those virally infected or tumor cells. The next two lymphocytes are impossible to differentiate by light microscopy. Both the B and T lymphocytes are round cells with densely staining dark purple nuclei and very little pale cytoplasm, which is dramatically different from all of the cells of the myeloid lineage. Of the two main types, B and T cells, we'll start with the B cell today. A common type of hem-onc question on your exams involves the site of differentiation and maturation of lymphocytes. The B cells are easy to remember in this respect because they go through both differentiation and maturation in the bone marrow. And you can think of the B in B cells as standing for bone marrow. The main function in life of a B cell is to produce antibodies. Also, like the macrophages and the dendritic cells, they can act as antigen-presenting cells with MHC class II receptors. Speaking of cell surface proteins, what are the two main B cell markers that the test could give you in a question stem or as answer choices? This would be the CD19 and CD20 cluster of differentiation markers. B cells circulate and travel through peripheral lymphoid tissue, like lymph node follicles, white pulp of the spleen, and unencapsulated lymphoid tissue to find antigen. When they find their antigen, they differentiate into plasma cells, acting as antibody-producing factories. Of note, activated B cells can also form memory cells, which are longer lasting, but less active than plasma cells, and have the same antigen specificity as the activated B cells that they derive from. After they've been activated and become memory cells, the next time the same antigen is encountered, memory cells are reactivated, and an immune response happens much more rapidly as a result. In this flash quiz, what is the enzyme responsible for the conversion of carbon dioxide and water to carbonic acid and eventually bicarbonate inside the RBC? Well, I didn't specifically give you the name in my lecture, but carbonic anhydrase was covered in previous chapters, and is an important enzyme to commit to memory for hematology, renal, respiratory, and well, really most of step 1. This is a pretty high yield enzyme. The majority of circulating lymphocytes are T cells. They are the workhorse of the adaptive immune system. T cells differentiate, or are created, in the bone marrow. But maturation takes place in the thymus, hence their name, T cells. Remember that B cells mature in the bone marrow, and T cells mature in the thymus. Each time, the first letter will give you the hint as for where the maturation occurs. As you will recall from our discussion in immunology, immature T cells can mature into 3 different types of cells: cytotoxic T cells, helper T cells, and suppressor T cells, with the first 2 being the most commonly tested on your exams. Cytotoxic T cells have T cell receptors as well as CD8 co-receptors. Co-receptor really means that it can't do much on its own, but these CD8 co-receptors are what make the cytotoxic T cells what they are. These 2 co-receptors interact with the MHC class 1 receptors found on nucleated cells and function mainly for viral immunity. Be sure to remember that. Immature T cells can also differentiate into helper T cells. And here, the big thing to remember is that CD4 co-receptors interact with MHC class 2 receptors. And what are MHC class 2 receptors on? That would be the antigen-presenting cells. It is also very important for your exam that these CD4 T helper cells are the target of attack for the HIV virus. That fact can be easily incorporated into many questions, and again would be a good question for you to have a bunch of cluster of differentiation options as your answer choices. An easy way to remember which MHC classes go with which cluster of differentiation for the T cells is the following equation. Your MHCs times your cluster of differentiation equals 8 every time. The 2 examples are MHC class 2 and CD4 go together. So 2 times 4 equals 8. And the same goes for MHC1 and CD8. 1 times 8 equals 8. Regardless of the type, T cells usually need a co-stimulatory signal to be activated, which can be provided by the CD28 on the T cell and the B7 on your antigen-presenting cell, or the CD40L and the CD40 we've discussed in previous chapters. For more detail, review your immunology chapter. As we stated earlier, plasma cells are the descendants of the activated B cells that basically function as antibody factories. As you can see here, they have an off-center nucleus in what is sometimes described as a fried egg appearance. And it's hard to see in this image, but other features of the plasma cell include the chromatin in a clock face distribution around the nucleus. You can imagine the numbers out here at the edge of the nucleus. The numbers I'm referring to actually represent heterochromatin that is condensed and placed around the outer edge of the nucleus. This cell is at the center of the pathology in multiple myeloma. In the pathology section of this chapter, we will discuss this cancer of plasma cells in more detail. Now let's test ourselves with a USMLE style question. A 6-year-old child is brought to the pediatrician after multiple bouts of wheezing and breathlessness on the playground. A diagnosis of asthma is made, and a follow-up complete blood count identifies a higher than normal percentage of granule-rich cells in the patient's blood. What is the major granular component found in this cell type? Heparin, histamine, major basic protein, myeloperoxidase, or IgE? The answer is C, major basic protein. The question stem gives us several clues about the cellular process that is being tested in this typical 2-jump question, meaning the question first wants you to identify what topic is being tested, and then know something about that topic. And that's exactly how we should attack this question. First, the topic. The question gives you a diagnosis of asthma, and we know that the question is asking for a particular cell type. We discussed 2 cell types that are involved in the pathogenesis of asthma, and those were the mast cell and the eosinophil. The eosinophil even has asthma in its mnemonic of diseases causing eosinophilia, we can see here, NAACP. The question stem also informs us that there is a higher than normal percentage of granule-rich cells in the patient's blood according to a complete blood count with differential. Well, both of the cell types we spoke about have granules, but only one of them is in our mnemonic for the differential of a complete blood count. Neutrophils like making everything better, or never let monkeys eat bananas. And that's E for our eosinophil. Okay, so we know that the question is asking about the eosinophil. Now the fact that they want us to know about this topic is, what is the major granular component of the eosinophil? And we said this was major basic protein, or answer C. The two-step question is very common on the USMLE Step 1, and being very well practiced at understanding what information the question wants you to recall can really help you narrow your answer choices, even if you don't know the answer right off the bat. As for our other choices in this question, heparin is a component of the basophil and mast cell granules, and is an anticoagulant in the type 1 hypersensitivity allergic degranulation. Histamine is also released by the basophil and the mast cell, and is a vasodilator used in allergic degranulation. Histaminase is released by the eosinophil to limit these reactions. Myeloperoxidase is expressed in the neutrophil and is used to destroy bacteria, and IgE is made by the plasma cells. Now that's a lot of knowledge about what cells make what proteins, but notice that the exam is first identifying what cell type, then asking for the pathognomonic protein that is only made by that cell type. Well, that's going to cover hematology and oncology anatomy, and we'll be moving on to physiology in the next video. See you then!